Next on Primary Care, we talk to Pediatric Surgeon Dr. Tara Scott about diabetes-related foot problems and how to best care for your feet.
The two most important things that I can stress to a patient to keep their limbs, number one, changing their diet, keeping those glucose levels under better control. But the other thing, those smokers, to stop smoking.
Hello, and welcome to Primary Care, the show dedicated to improving the health and care of African Americans. I'm your host, Dr. Lonnie Joe. It's important for people with diabetes to take care of their feet. A small cut on the foot can become a serious infection that could lead to amputation if it's left untreated. African Americans, who are 2 times more likely to have diabetes compared to other racial groups, are also 4 times more likely to experience limb loss or amputation. Joining us today to talk about diabetes-related foot problems is Dr. Tara Scott. Dr. Scott is a board-certified pediatric surgeon at the Foot and Heel Pain Institute of Michigan. She is well-versed in all areas of pediatric medicine and surgery, with a special interest in diabetic patient education, wound care, and limb salvage. Dr. Scott, welcome to the show.
Thank you.
Thank you so much for joining us.
Thank you so much for having me.
You know, Dr. Scott, one of the worst things that happen in our office is when a patient walks in and says, I've got this sore or this ulcer on my foot, and you find out they're diabetic, and you go to all these different places about what the future holds for that patient. What is this overall impact of diabetes on the foot?
Oh my goodness. Without proper care, 20% of foot ulcers lead to amputation of the lower extremity.
It's that high?
It is that high, that high, if untreated. If untreated and waiting to the last minute to come to the doctor's office, self-treating at home, that's a huge problem in our population. Oftentimes they see a problem, try all these home remedies, and then by the time they get to the office, it's out of control. This
is a nightmare for a lot of patients. The complications, the ulcer itself is bad enough, but the other complications surrounded it, like neuropathy and the poor circulation, it goes on and on.
Absolutely. Those two things actually contribute greatly to the prognosis of the ulceration. And in fact, for those that develop an ulcer on their feet, in 10 years, they're twice as likely to end in death without those that develop the ulcer. So,
you mean we have statistics?
Yes.
That say
yes,
increased death rates?
Twice as
diabetic
high.
Foot ulcers.
If those that
treated.
have a diabetic foot ulcer, it's twice as high for death in 10 years for those patients, because a lot of the issues are related to how they are, the status of the patient systemically at that time. So most of these patients that come in have extremely high glucose levels. They already have symptoms of neuropathy. They have symptoms of peripheral artery disease. And all of those things have a major impact on the patient.
So how often should these patients be seeing a podiatrist?
Depending on their symptoms. So when they come into my office, we do a screening, so to speak. The first thing we check is the blood flow to their feet. So just like you can feel a pulse in your wrist or your neck, you can actually feel a pulse in your foot. If we can feel it with our fingertips, that's half the battle. Those patients who have non-palpable pulses usually indicates significant peripheral artery disease, some blockage of the arteries, and they just don't heal well. If there's not enough blood flow to the tissue, then it won't heal, so their prognosis isn't as great. And just with neuropathic symptoms, those patients with high glucose levels have more severe neuropathy. They can't feel, what's going on with their feet. So those patients that have those symptoms, we see definitely more often. I usually will see 3 to 4 times a year for just a routine diabetic check. Also to educate them on things that they need to be looking out for. The most important thing for them is self-inspection, and I tell them, check your feet every single day. Look under the bottoms, look in between the toes. I have a lot of older patients where, I can't see under the bottom of my foot. put a mirror on the floor, put your foot over the mirror. If you have family members who are in the home with you, have them check. Those patients that don't have the significant symptoms of peripheral artery disease or high-risk areas or neuropathy, then once a year is appropriate.
How should the primary care physician get involved in this approach to caring for a diabetic foot?
In general, that should be part of their routine. When that patient comes in the office,
take your shoes
just
and socks off.
take your shoes and socks off, take a look at them, and if you see a problem, refer them to a podiatrist if they don't have one already. And in my office, when I see my diabetic patients, I will send a note to the primary care physician, to the endocrinologist, just to let them know, okay, this is the status of the patient, and if I'm doing any further testing regarding their vascular status.
One particular complication that we run across in various joints sometimes is Charcot joint.
Oh, yeah.
Talk about that in the diabetic foot.
Absolutely. So, most of the time just like I said, we're so concerned with peripheral artery disease, not getting enough blood flow to the feet. With Charcot arthropathy, it's a complication you see in diabetic patients, more so those with symptoms of neuropathy, which is that decreased sensation that you have in your feet, which can progress to the point where you have no sensation. So literally, I have people that can step on something and not feel it, have an issue and not know it. I've had patients that have stepped on glass, toothpicks, nails, literally couldn't feel anything until they saw drainage on the sock or swollen foot. So with Charcot arthropathy, there's an increase in blood flow, the decreased sensation. That increase in blood flow actually breaks down the bones in the middle of the foot. So literally, the foot can collapse and develop a whole different shape, broken bones. And the patient has no idea. They just notice their foot is swollen, misshapen. They come in, and that's what we find. Very common complication you can see in those out-of-control diabetics.
I've seen over time patients come in with foreign bodies in the foot from something they've stepped on. They didn't even know it was there.
I had a patient once that worked on a construction site and was putting his same construction boot on every day, had gone to the ER because his toe was swollen. They gave him antibiotics, sent him home. He came into my office, full-blown diabetic foot infection. I happened to look in the shoe, and this is the scenario. A nail had gone through the bottom of the shoe into the toe. He was putting that shoe with the nail in it on every day and had no idea. Ended up with the amputation of that great toe from that. But the neuropathy was so severe, he had no idea.
He lost the sensation.
Yes.
So these ulcers that invariably are going to happen when this care is not approached properly, what's the approach to them? I mean, is it, if it's a little ulcer, we're all happy. Yeah. But a lot of times, the size of the ulcer is not an indicator of what the real problem is.
Yeah, the real problem, and I'm talking to patients all the time, if you have an ulcer, if you are not eating properly, your glucose levels will remain high. If you aren't wearing the proper shoe gear, the ulceration won't heal. What we do for an active ulcer, there's active wound care is important in that process. I will usually see a patient once a week to debride the wound, make sure they are being treated with appropriate antibiotics, doing different treatment options to offload the wound. That's important to get the pressure off of the wound. Usually we'll do a surgical shoe with accommodations in it, which help to take the pressure off. Sometimes we have certain casts that we apply to take the pressure off of the area. And really the patient just being compliant, keeping their appointments, which is very important, taking the antibiotics as directed, doing the daily dressing changes. Oftentimes we'll have home health care come in to those patients that need it. And some people need more aggressive treatment if the wound progresses to bone infection. We work with wound care centers for hyperbaric oxygen treatment, things like that.
So it's a combination of things
Absolutely.
that people have to be aware of,
Absolutely.
patients, caregivers, physicians included. that actually say, listen, let's talk about how we keep this foot healthy. What signs or symptoms should people be looking for? Is one more prevalent than the other? Is one more important than the other?
I think definitely if you have any drainage, color changes are very important with circulation and infection. So when you start to get symptoms of decreased circulation, the skin may turn darker. There may be decreased hair growth. Feet feeling cooler than normal. So one foot may be cooler than the other. The color changes, if you also see a purplish discoloration to the digits, may indicate a problem. Checking in between the toes. Sometimes you can get cracks and fissures in between the toes, which can lead to bacterial infections. Swelling, things like all those things make a difference. And when you see a problem, don't wait. Call the office. I tell my patients, I don't care what it is. I'd rather you come in and be safe than to have an issue and think it's nothing and it ends up being something
I'd rather
more
know
severe.
than not know.
Yeah, exactly.
Instead of finding out when it's like, now we have another problem on top of the existing one.
Exactly.
So this is a part of patient education in terms of
Huge.
getting them to participate and buy into their care.
Huge. So my first visit, I have a list of things, don't do this, don't do that. And a lot of the things are more extreme for those patients with severe neuropathy, like don't soak your feet. And we can't soak our feet. Well, it really more so is those patients with significant neuropathy can't tell how warm or hot the water is. So they soak and get burns from that. I've had this happen several times too. In the winter months, people put their feet close to the heater and then they come in with blisters and sores and had no idea that that's what it was, but because of the neuropathic symptoms, they can't tell. So it's about educating. Wearing proper shoes, that's another thing. If you have significant deformities of your feet, hammer toes and bunions, which are hammer toes, instead of the toes being straight, they're a little prominent, or bunions, the big bony prominence on the side of the foot. And everybody still wants to be cute and wear their cute shoes. And then we'll put these shoes on and end up with blisters and sores from that. So very important, when you get a new pair of shoes, once you take them off, inspect your feet. Look to see if you have any areas of irritation.
New abrasions, whatever.
Exactly. I also recommend that people buy their shoes at the end of the day, because the majority of the time the feet are swollen by the end of the day. So that way you're getting a proper fit.
And don't be a slave to fashion. I'm going to wear these shoes because they fit this outfit. And I don't care how bad it hurts, I'm going to limp till I get home to take them.
Yes, I have patients. Beauty is pain.
Yes.
No.
I like that.
But no, I definitely educating. And with diabetics with a history of ulcerations, they have the opportunity to get diabetic shoes and insoles, which are covered by most Medicare insurances. And there are insoles that are placed in the shoes that are accommodated for those patients that have a history of high pressure points or ulcerations. Then they have the option for these shoes. We fit them for the shoes in the office, or they can go to some of the durable medical equipment companies to do it.
Dr. Scott, this whole thing about disparities won't go away. It keeps coming up in our discussion and our circles. And when we hear things like every 3 minutes a black person is having an amputation in this country, it's just distressing. I mean, what can we do? Why are we here?
I think the most important thing is just as a population, African Americans just don't have access to health care like others. The access is not as available. And so it's very important that even if it's churches or organizations, having health fairs, having free events where we have an opportunity to do foot screenings, do screenings for diabetes, high blood pressure, hypertension, all those things, and then to be able to refer them to other places. We have to educate them better about their nutrition, eating well. Most hospital systems, I know Ascension has a diabetic education program. Once we can get the patients into the system, we can educate them about, you know, alternatives to their traditional soul food, fried food, healthier alternatives for preparing their meals, exercise, which is very important in heart health and foot health because it increases the blood flow to the feet, helps the arteries to function better, so to speak. And it's really just more about education, exposure, and getting into the communities to do that.
So you keep touching on this multidisciplinary approach, which is important to bring in things like community involvement.
Absolutely.
Okay.
Absolutely.
That seems to be lacking. We seem to have all cylinders are not functioning at the same time. Therefore, we get these disparities that occur.
Absolutely.
And the sporadic care gives us this sine wave up and down that just doesn't get us to the end point.
Right. I totally agree. I think another just important place is within the church. I have been involved, I'm a member of Triumph Church, and I've been involved in health fairs, educating patients through that, which is, you know, and I think we should do more of that. My Links organization has an event coming up that will be held at Second Ebenezer. So again, it's the communities, just touching into those communities, and that's a good source, I believe.
Right. I mean, you know, if you go back far enough in history, you'll see where physicians were community leaders.
Absolutely.
And then they were doctors.
Yes.
Okay. And we seem to have focused so much on being a doctor that we forget about the community that we're there to serve. But here again, that's an excellent point that you bring up. But here we are, 2024. Everybody's in this health craze phase. We're all athletes, and we're pounding on these feet that we've been walking on since we were 1 year old, basically. Okay, how is that impact of affecting foot care? Because some people have just run too much on asphalt and concrete.
Oh my gosh, yeah. The shoe is everything, and I'm always telling patients, even if you're a walker, get a running shoe.
Get a running shoe, yes.
The running shoes, they give you more support. There's more shock absorption as your feet are hitting the ground. And for my diabetic patients that I'm encouraging to exercise more, I actually tell them to go to a running shoe store, get fit for your shoe. And then that way you have the proper support. It needs to be wide enough. It needs to be, you know, supportive. There are certain shoes based on whether you have a flat foot or a high arch foot. So again, being active, wearing the proper shoe is important. And in diabetics with structural issues with their feet, they want shoes that have a little extra depth to them. So that way, if you do have bunions or hammer toes or whatever, you don't have that irritation when you're getting that exercise in.
So we have to complete the cycle. I mean,
absolutely.
Including the exercise, which is very important in being a diabetic anyway. How do you get exercise? You more than likely going to be using your feet in some capacity.
Absolutely.
Okay?
Absolutely.
So with that in mind, and we build and think about programs that encompasses all these elements, we should have better outcomes.
I agree. I agree. I think it's just, again, bringing it all together with community, with the physicians, with education, regarding all of those things. The American Diabetes Association actually is a good resource too, that has, if you go on their website, they have all kinds of educational information regarding diet, foot care, exercise, you know, how diabetes affects your eyes, your kidneys, all of that. So I think that's a good resource as well. But again, when the patients come into the doctor's offices, we have a responsibility to educate them about those resources, in addition to educating them ourselves, to give them the proper resources so that they can follow up and encourage the follow-up. And when they come into the office, did you go to see the vascular doctor I referred you? Did you go to the dietitian to learn what foods you should and shouldn't be eating? Did you, get that gym membership? Or there's free memberships for a lot of our elders. Silver Sneakers is a program that's out there that encourages healthy living and exercise.
So unfortunately, Dr. Scott, too many people have amputations. And when they do have an amputation, what are the challenges that they're going to face with this? I mean, especially from a prosthetic standpoint of view.
Yeah, I think if they can get past, this is probably one of the hardest things that I deal with with my patients. Just encouraging that, because at this point you're their doctor, but then you also sort of become, you know, a psychologist in a sense.
Exactly.
And just encouraging them to just know that their life is not over just because they lost part of their foot or their lower limb. I have plenty of patients through the years, I've been practicing for over 20 years, that unfortunately may have lost a limb, but still go about their normal daily lives. They still drive. They still do all the things that they used to do. So just encouraging those patients that, okay, just because you lost one limb doesn't mean you have to lose another. Let's make these lifestyle changes. Oh, a huge thing that I didn't touch on before is smoking. The two most important things that I can stress to a patient to keep their limbs: number one, changing their diet, keeping those glucose levels under better control. But the other thing, those smokers, to stop smoking. The smoking causes constriction of the blood vessels, which further decreases the blood flow to the feet, which increases the risk for amputation. So just in that lifestyle change, stop smoking, keep your glucose levels under better control, start exercising when you can, and just go to the treatment, go to physical therapy, go to the fittings, you know, get out of your feelings, and get up and move on with your life. You can do that.
Right, that's certainly possible and achievable.
Yes.
Especially with all the support that patients have
Absolutely.
access to.
It's available.
It's available. It's available. We should take away the excuses after a point for not doing these things, especially in the diabetic population. There are studies and charts now that we have available for our understanding and education as providers. And if we're not careful, in just a few years, the majority of people in this country are going to be type 2 diabetics. Which is going to be startling because it is a totally preventable disease.
Absolutely, absolutely. Right now we're hovering 13 to 14% in African American females and males with diabetes in this country. And so it does not have to be that way. We have to just make a decision that, you know, we want this lifestyle change. Our lives can be better. We can live longer. You know, we don't have to continue the same habits that, you know, our parents had and our, you know, we're living longer and we want a good quality of life. And to do that, we need to make those changes.
Yeah, it's in our office, it's 90-year-olds showing up is no big deal now. It's every day, all day. But so what are we looking forward to in the future in terms of what can we expect? Things coming down the pike? Are we looking forward to new medications, new treatment modalities? We see a lot in the literature publications about the microvasculature and looking at the endothelial lining of the vessels and those sort of things.
Let's hope that we can. There are a lot of new treatment options specifically for diabetic neuropathy, and it's sort of a mixed. I've seen mixed results. There are some companies out that are like, oh, we do electrostimulation to the feet, and that increases the blood flow to those small vessels, which help to treat the symptoms of neuropathy, or infrared, you know, therapy, you know, checking the temperature of the feet and making a prognosis based on that. And those are all things that are helpful. Foot mapping, where they test the pressure when you're walking. But ultimately, it still comes down to the bottom line of eating better, making healthier choices, exercising. That's the root. That's the core. That's the main thing that's going to help. All these other modalities, there's no cheating quick way. You know, we really have to just put in the work and encourage our patients to put in the work so that, you know, it will make a difference in their outcome.
Right, inviting the patient on a more forceful
Yes.
approach
Yes.
to be partakers and buy into the treatment of their
Yes.
care
Yes.
and what we're doing. Everybody wants, like you say, wants
A
this
quick
quick fix,
fix.
right?
But
A
it
pill
really-
is going to resolve everything. You know, it's not going to happen.
Absolutely. But it really is a lifestyle change. When I used to do a lot of diabetic education lectures, and one of the things that I love to show were the worst looking diabetic foot infection. It's shock factor,
people, yeah.
you know, but it was the reality, you know, is this: if you don't make XYZ changes, then this could be you. So let's, you know, be proactive and make those changes so it doesn't end up like this.
Excellent. This has been outstanding.
Yeah.
Thank you so much.
Thank you.
Good,
Thank you
good.
so much for having me.
Good. Our guest has been Dr. Tara Scott, Pediatric Surgeon at the Foot and Heel Pain Institute of Michigan. Foot pain is common in people who have diabetes. Regular foot checks and exams are important. Not important, they're necessary to avoid complications like foot ulcers, injuries, and amputations. Until next time, for Primary Care, I'm Dr. Lonnie Joe.